Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic and practitioner of functional medicine. I've got an exciting show for you today. It's going to be mostly about omega-3 fatty acids, which are mainly, the most important ones are from the ocean. All the tremendous benefits for cardiovascular health, for your brain, and virtually every part of your body benefits from getting adequate amounts of these omega-3 fatty acids. But before I get into that, I have an exciting announcement. When I started this program 2 years ago, I could only imagine what kind of response I would get. And it has been tremendous and a profound blessing. So thank you, all of you who keep tuning in and contacting me, sending questions, and keep informing yourselves and taking responsibility for your own health. My mission with this show has been to arm you with reliable information you can use to fill the gap between standard medicine and maybe why you're still not getting what you need, or why you might still have unexplained symptoms that are very real and probably have a solution available that is effective and natural and safe. So it's been my pleasure to host this show every week for 2 years now. And I also very much enjoy doing live presentations with a big screen and a PowerPoint and the opportunity to see you face to face and answer your questions. So I'm announcing a new series of live events, which will take place every first Wednesday, the first Wednesday of the month, in my office. So this radio show, Safe Effective Natural Solutions, the radio show, is now being augmented by a monthly live presentation in my office in downtown Ventura, 961 East Main Street. And it's going to be the first Wednesday of every month, starting October 1st. October is Breast Cancer Awareness Month. And that's a good thing, but I always like to focus on breast cancer prevention. How can you reduce your risk of getting breast cancer in the first place? How can you reduce your risk of breast cancer recurrence if you have had it before? And for those who are in recovery, how can you reduce the debilitating side effects of chemotherapy, radiation, and other cancer treatments? These will be the focus of the first live presentation in my office, October 1st, Wednesday at 6 o'clock. Bring your friends, bring your family, join us we'll have some light refreshments and a 30-minute presentation followed by questions and answers. This is all free of charge, and I'll be happy to answer any question you show up with. So what common questions I get are things like, is it safe to take supplements when you're also on medication? Or how do you know if you're getting all the nutrients you need to heal whatever conditions you have and to be truly healthy? How do functional medicine tests identify these conditions that so many other doctors miss? And what are the most important tests for you? Everyone's a little bit different. So I look forward to seeing you there, 6 p.m. every first Wednesday. The first one is October 1st, 6 p.m. in my office in downtown Ventura. So this week we're going to talk about omega-3 fatty acids, which are mainly from the ocean, from eating oily fish like sardines and salmon and oysters, or taking fish oil supplements. And one of the most common questions I get is, can you take supplements while you're on medication? And a lot of people, one of the questions that comes up around that a lot is if someone's on blood thinners. If you're on blood thinners, it doesn't necessarily mean that you can't take most supplements. The one major exception to this is if you're taking warfarin or coumarin, same thing. That's the old classic relatively inexpensive blood thinner that a lot of people still end up needing to take for various reasons. When you're on warfarin or Coumadin, you can't take vitamin K because it interferes directly with the mechanism of that drug. But most other blood thinners, like things like Plavix, antiplatelet medication, and Eliquis, drugs like this, there isn't really any contraindications between most supplements. So, ask me if you have any special questions about that. But it's a common misconception still that fish oil increases bleeding. Lots of doctors used to think, oh my God, if you take fish oil, it's going to increase your risk of bleeding, especially after a surgery. Well, so I have a little story for you. I went and had a colonoscopy a few years back. I like to practice what I preach. Prevention is important, and I didn't really have any strong risk factors for colon cancer, but I thought, okay, I'll get that test so I can say I've done it. And when I went in, they gave me a list of things to not take for the week before the actual test. Don't take any aspirin, don't take any ibuprofen, and don't take any fish oil supplements. So when I got there the day of the test, the nurse reviewed those things. So she said, "Do you take any aspirin?" this past week? No. Did you take any ibuprofen? No. Did you take any fish oil supplements? I said, yes, I took fish oil every morning this week, including this morning, about 2 hours ago. And she says, oh, why did you do that? And I said, because fish oil, there's no contraindication between taking fish oil supplements and any kind of surgery. In fact, it improves surgical outcomes. And she looked, kind of dumbfounded. And I said, go get the doctor. So she brings him back. The gastroenterologist comes up and he says, have you got any data to back that up? And I said, sure. What's your email? And I sent him several studies. The main one was on the Journal of the American Medical Association back in 2016, completely refuting any increased risk of bleeding. The study was published in 2016 by William Harris, PhD, in the Journal of the American Medical Association, and says, quote, the idea that fish oils increase risk for bleeding is a legend that persists despite substantial evidence to the contrary. In 2014, we reviewed the literature regarding the risk of clinically significant bleeding associated with fish oil use and concluded, quote, these agents do not produce clinically significant bleeding. Well, I also went on to send him several other studies that show it actually improves surgical outcomes for many reasons, which we're going to get into today. But it was pretty impressive because he took that in and he said, okay, and send that data to me. And the following week, I think it was Monday or Tuesday the following week, I got an email that he copied all his staff on, communicating to them now that, the latest data shows that there is no increased bleeding risk when you take fish oil supplements. There was another story that I remember. One time I was at a presentation that a dentist was giving a presentation on a case where he was worried because, it wasn't his patient. It was something he read in a dental journal about a patient that's developed unexplained profound bleeding after a surgical procedure. And the article said, you need to find out what supplements your patient's taking because that could be causing the unexplained bleeding. Well, that's just ridiculous. I said, what supplements was she taking? Vitamin D, fish oil, and a couple of other things. So I looked up all of those things. And the following week, this is a meeting that I attended regularly. And the following week, I presented a rebuttal to that article. I actually subscribed to the dental journal in question to find all the specific details of that article. And searching, you go to the bottom of these articles, fish oil increases bleeding. So said this paper from this journal, and I followed that down. You go to the bottom of each one of these journal articles, and there's a reference that this article referred to this article, and they just kept referring to the same article over and over and over again that was ultimately based on a study done in 1981 that said there was increased risk of bleeding if you take fish oil. And it was just ridiculous. I found that study, and this was so long ago. It was before they had the standard test they used to measure blood clotting now, bleeding, risk of bleeding, international normalized ratio, the prothrombin time. If you've ever been on warfarin, you'll know about those tests. Instead, back then, the way they measured bleeding and clotting time was they would produce a little cut, a 1 millimeter deep cut, 1 centimeter long on the skin and your wrist, of controlled incision, very, very minor cut, kind of like scratching yourself maybe with like if you got a scratch from a cat. And then we'd set a timer and see how long it took for the scab to form. That was how they measured bleeding back then. And there was a normal range. And this study showed that when people took fish oil, they went from the very low point of the normal range for this type of measured clotting time to the middle of the normal range. So basically what they showed is that if you take fish oil supplements, your clotting time will go from normal to normal, from low normal to mid-normal, which is so all these other journal articles for years after that headline, fish oil increases bleeding, and they just referred to the same references over and over again. And it was ultimately all based on that really, really misleading test from decades ago. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to almost any health challenge. We're talking about fish oil, omega-3 fatty acids from fish and fish oil supplements, and the benefits of that. Here's another study about the old, now completely refuted confusion in the medical press and among the medical community about the interaction between fish oil and bleeding. This is from the American Heart Association journal Circulation in 2018. The background on this is listed as fish oil is among the most common natural supplements for treatment of high triglycerides and prevention of cardiovascular disease. And however, concerns about theoretical bleeding risk have led to recommendations that patients should stop taking fish oil before surgery or delay in elective procedures for patients taking fish oil by some healthcare professionals. So They tested the effect of fish oil supplements on bleeding before and after surgery with a multinational placebo-controlled trial, 1,516 patients, average age 63, who were randomized to take fish oil or not. And they gave them high doses before perioperative fish oil. The first 2 to 5 days before surgery, they gave them 8 to 10 grams for 2 to 5 days before the surgery. That's a lot of fish oil. That's about 6 or 8 capsules of standard fish oil, or eating several servings of fish. And then they lowered it to 2 grams a day after the surgery, post-op. 2 grams a day is 2 to 3 grams a day is a healthy dose for most people. So the conclusions of this study: fish oil supplementation did not increase perioperative bleeding and reduced the number of blood transfusions. And the patients who had the highest levels of omega-3s in their blood had a lower risk of bleeding. A lower risk, not a higher risk at all. It actually had a lower risk and other improved outcomes. So they recommended doing further studies to find out and better understand these beneficial effects of fish oil. So here's one that was published in the Journal of the American Medical Association Cardiology. That's the conclusion of which is that omega-3 fatty acids present in cold water fish such as herring or salmon are commercially available as supplements, and they can decrease triglyceride concentrations 20 to 50% by reducing the production of triglycerides in the liver and increasing their clearance. And importantly, with long-term intake, they may increase HDL-C, which is the good cholesterol, the high-density lipoprotein. The good cholesterol is increased when you take fish oil supplements. Another study in the Journal of the American Medical Association looked at the risk between stroke and omega-3 fatty acids and found, this is from 2001, higher consumption of fish and omega-3 fatty acids is associated with a reduced risk of thrombotic infarction, which means a reduced risk of a clot flowing downstream and blocking a blood vessel in your brain, causing a stroke, reduced by taking fish oil. Well, here's an even more impressive study on dietary consumption follow-up data from 84,688 female nurses enrolled in the Nurses' Health Study, aged 34 to 59 years, all free from cardiovascular disease at baseline in 1980. And then they followed up with questionnaires completed 4 years later, 6 years later in 1984, 86, 1990, and in 1994. And then they published the data in 2002, and higher consumption of fish and omega-3 fatty acids is strongly associated with a lower risk of cardiovascular disease and death from cardiovascular disease. So that's pretty good data, 84,000 women. And it's an important distinction to know. People often ask me, well, what about flaxseed and chia seeds and walnuts and the plant-based sources of omega-3 fatty acids? So most of the studies are studying fish oil from fish, so eating fish or getting the omega-3 fatty acids from fish consumption. So there is some data that shows that the omega-3s that are in the plant-based sources like flaxseed, walnuts, leeks, tiny amounts in almonds, pinto beans, and kale, have modest cardiovascular benefits. I tell people to think of flaxseed oil as kind of like olive oil. It's a good oil to put on your salad. It's a good fat to consume in your diet. But the problem is that people falsely sometimes assume that you're getting all the benefits that you hear about from eating fish and taking fish oil supplements by using flax oil on your salad or eating chia seeds or walnuts. And that's just not true, because your body has to convert ALA, the alpha-linoleic acid that's in flaxseed, all of the plant-based sources of omega-3s. If you see anything that's not from the ocean that says good source of omega-3s, then that omega-3 they're referring to is ALA, alpha-linolenic acid. And that doesn't really have any benefits in your body until it's converted to EPA or DHA, which are the two main omega-3s in fish. And your body converts about 5% of ALA to the famous EPA and DHA that are in fish oil. So they're good things to have in your diet. They're good fats like olive oil. They're a good source of high-quality fat calories to consume and get the nutrients from that. But they don't have the well-understood benefits of EPA and DHA, the fish oil, the omega-3 fatty acids that are in fish and fish oil. And I say from the ocean, they're also in algae oil. So if you're vegetarian and you want a non-fish, you don't want to have to kill fish to get your omega-3s, it's a great idea. Algae oil is also high in the important omega-3s, DHA and EPA. But for some reason, which I don't understand, the fish oil, the Nordic, if you're wanting to get some of this, Nordic Naturals is the one I recommend. There's a couple other companies. I think actually Orthomolecular and Designs for Health have a veggie fish oil now too, which all of these are from algae oil. The problem is they cost about 2.5 times the amount to get the same dose of fish oil from algae, omega-3s from algae, versus getting it from sardines and anchovies, which is where the regular fish oil supplements are made from. Cold water anchovies and sardines off the coast of Norway or off the coast of Chile, little fish that haven't been alive long enough to accumulate many toxins, which the ocean is filled with. So while we're on that subject, don't buy cheap fish oil. One of the main reasons to get a high-quality fish oil is because the equipment necessary to properly filter and test that fish oil to make sure that it's free, minimize the amounts to an absolute minimum amounts of any toxins that are stored in the fat of that fish. You're consuming these particular fish because they're fatty and they have high amounts of omega-3 fatty acids. But fat is where all toxins are stored. If you're exposed to any kind of toxin in your environment, it ends up stored in fat cells in our bodies and in fish. So I only recommend fish oils that I've seen the testing data from, and they don't just hand this out. It's hard to get this information directly from the manufacturers, but I've seen the data to prove that the fish oils are clean from Nordic Naturals, from Designs for Health, from Orthomolecular Products, and from Metagenics. So primarily now I recommend to my patients the ones from Designs for Health and Orthomolecular Products because they're high quality and they don't have the fishy taste or the burping issues that some other fish oils have. But one of the things I really strongly encourage people to not buy from Costco or any other store really is cheap fish oil. A good quality fish oil costs about, for two capsules a day, about 1.5 grams combined EPA and DHA dose. Costs about $50 to $60 a month for 2 months worth. $50 to $60 for 2 months worth. So about $25, $30 a month for a good quality fish oil. So if your fish oil is, half that for a month's worth, $10 a month for a month's worth or something like that, which there's lots of places that sell that kind of stuff. I don't recommend it. You don't really know what you're getting in addition to those omega-3 fatty acids in products like that. So Nordic Naturals is available in stores if you want something that you can go out and pick up in a health food store. And the other brands are usually only available in doctors' offices or from websites that doctors, different functional practitioners carry. These are not the only good brands, the only brands that have been tested. They're just ones that I'm familiar with and have used on thousands of patients over the many years, and tested before and after to confirm that they're getting the anti-inflammatory benefits, the heart benefits, the changes in brain focus, people with autoimmune conditions, rheumatoid arthritis, any kind of arthritis, any inflammatory condition. Fish oil helps with all of these things, and when you take the good stuff, you see those changes reliably. Here's another great study originally published in the Archives of Internal Medicine on the many benefits of omega-3 fatty acids. Among them, antiarrhythmic, reducing abnormal heart rhythms that can cause your heart to skip a beat or cause atrial fibrillation. It's an antithrombotic through multiple mechanisms that reduce clots that can break off and travel to your brain and cause a stroke. EPA, eicosapentaenoic acid, one of the main omega-3s from fish oil, enhances the vasodilation effect of nitric oxide. I talked a lot about this in an episode a couple weeks ago. Nitric oxide helps relax your blood vessels, reducing blood pressure. It's important to have adequate acid in your stomach because you need that to produce adequate amounts of nitrous oxide, but the fish oil enhances the effect of nitrous oxide, also relaxing your blood vessels, helping to reduce blood pressure and other risk factors for cardiovascular disease. Both EPA and DHA have also been shown to inhibit the plaque formation that causes hardening of the arteries. So the effect on lipid metabolism is predominantly its ability to reduce the formation of plaques. And it does this by lowering total cholesterol and triglyceride concentrations by inhibiting the very low density lipoprotein and triglyceride synthesis in the liver is the mechanism. But here's the takeaway. Existing evidence from epidemiological studies, animal studies, and human intervention trials supports the role for omega-3 fatty acids in the prevention of coronary artery disease. Several randomized controlled trials with omega-3 fatty acids have demonstrated relative risk reductions in coronary artery disease similar to the landmark trials in hyperlipidemia with the HMG-CoA reductase inhibitor. So that's a mouthful. What is an HMG-CoA reductase inhibitor? These are statin drugs. So this basically what the conclusion of this study says is that fish oil works as well as Lipitor. Fish oil works as well as Zocor, as simvastatin and atorvastatin at reducing risk of coronary artery disease. So did your doctor tell you that? Oh, we want to put you on statin drugs, but just so you know, you could just take fish oil. It probably works just as well. And there's a lot of people that would push back on that. I'm oversimplifying a bit. A lot of people do take fish oil and still have high cholesterol. Sometimes you need a little extra support. But the point is, there are ways to effectively lower your risk of cholesterol and, more importantly, lower your risk of heart disease, which isn't the same thing. Cholesterol is not the only risk factor for heart disease. And there are lots of ways to reduce your risk of having a heart attack or a stroke without taking statin drugs or any other drugs. And the only way you know if you're a candidate for that, and it's a good thing that you should consider, is to get tested, to get proper testing to identify what is your cholesterol now. What are other important things that influence cardiovascular disease, like measures of inflammation, C-reactive protein, erythrocyte sedimentation rate, which is a measure of blood viscosity. You can measure how thick your blood is with this sedimentation rate test, which is a direct marker of inflammation. And there are a few others. So if you identify your actual risk factors, not just your cholesterol, and you do a good job with your diet and supplements where necessary, you can dramatically reduce and test and confirm that you are keeping your risk at a minimum for cardiovascular disease, given your risk factors from family history, from your diet, from anything else you're doing. If you test properly and take some things to alter that and then test again to make sure you're okay, you can dramatically reduce your risk of heart disease. Well, anything that reduces your risk of heart disease also reduces your risk of any disorder of the brain, especially Alzheimer's, other forms of dementia, but depression and anxiety, mood disorders, Parkinson's, anything that troubles your brain benefits from you can reduce your risk of those things by having adequate amounts of omega-3 fatty acids available to your brain. Your brain is mostly made of fat and water, and one of the main fats it is made from is docosahexaenoic acid, DHA, which you can only get directly from the ocean, from fish oil, from algae oil supplements, and supplementing that has dramatic effects. There's some really fascinating studies with people with traumatic brain injury where they just end up in a hospital with severe debilitation, inability to speak and inability to get out of bed and walk, and horrible disabilities from traumatic brain injuries, soldiers and people that have been in car crashes, motorcycle crashes, and they give them massive doses of fish oil and have seen some miraculous recoveries. Your brain is totally dependent on adequate amounts of omega-3s to function at its peak and to heal and repair from trauma and to regulate stressors like all the stresses of modern life that result in such high incidences of anxiety, depression, and dementia. Because it's anti-inflammatory, it also helps reduce any inflammatory condition like arthritis. So I recommend fish oil to every single one of my patients because of these many, many benefits on virtually every aspect of your health. Remember, the condition of your body is always more important than any condition you've been diagnosed with. So do something this weekend to be a little healthier than you were last weekend. Go out for a walk. Meet up with a friend you haven't talked to in a long time. Call somebody that you haven't spoken to in ages. Do anything, whatever you notice is stressing you, figure out a way to take a little bit of that, reduce that stress just a little bit so that you can be a little bit healthier next week than you were last weekend. I'd love to hear from you. What do you like about this show? What would you like to hear more of? Is there a health topic or a condition that you'd like to hear or know more about? Please let me know if it's something you're interested in. Many other people probably are as well. You can email me, Dr. Binkley at BinkleyHealingCenter.com, or you can even text me at 805-218-3939. And even better, come join me October 1st for the first of the new series I'm doing live in the office, complementing this radio show with live events in the office. We'll be talking about breast cancer prevention. Bring your friends and family. Ask any question you'd like. I'd be happy to answer them. 30-minute presentation followed by Q&A. We'll have some light refreshments, and I'd love to see you in my office Wednesday, October 1st at 6 p.m. Have a fantastic weekend.
You've been listening to Safe, Effective Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at BinkleyHealingCenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones because our health matters. Join him next Friday at 2 p.m. for Safe, Effective Natural Solutions here on 98.3 FM, The Word.